Well, thank you guys for coming in today and meeting with us. We just more or less wanted to set the record straight and get some information out there to our community. We all live in this community. We love Grand Island. We want to do what's best for our patients and for our friends and families. We feel that the impetus behind this project, the new hospital project, is to restore local control to our community, to our medical staff, to our hospital. That's been one of the big issues that we've had, and it's been a painful issue. We like our local administrators. We like the staff at the hospital. We really have all put our heart and souls into working hard to take care of our patients and our community here at St. Francis, but that has been more and more difficult, and so we're looking for an alternative, and this hospital project is the result of a lot of months, almost a year of work to get to this point.
Now we just are here to answer any questions that may have come up and go from there.
Is there any specific issues with CHI and that organization that kind of precipitated this? I mean, was it the Blue Cross Blue Shield, or was that just kind of the thing or were there other issues?
I think the Blue Cross Blue Shield issue with CHI was definitely a tipping point. That made practicing in Grand Island particularly really difficult for our patients especially. We've had to travel a lot to take care of people. They've had to be disrupted from their primary care physicians. It's really a problem, but that's not the end-all be-all to what's causing this. I think that it's a bigger issue with regards to just being able to control the healthcare decision-making here in Grand Island, and that's just not really as possible as it was in years past.
Is there a sense that the governing structure there, the decisions are being made out of state and not with as much local input as would be ideal?
I think that's a lot of the issue. Yes, it would be. I think healthcare is delivered locally, and a lot of those decisions should also be made locally.
Can you give an example of the healthcare decision-making difficulties? I don't know that I fully understand. You do. You understand the medical, how that all works. I don't understand that. Are you saying that people aren't getting the care that they need because of what's available based on decision-making elsewhere, or how exactly does that healthcare decision-making, I don't really understand.
No, I think that people are getting excellent health care in Grand Island. I mean, there's no doubt that if that were, excuse me, if that were a problem, that'd be a whole different issue. But I think the health care that's being delivered in Grand Island is top-notch, and that's because the physicians that we have here, the ancillary staff that we have here to take care of patients are top-notch. So I have no concerns about health care that's being delivered here. It's just becoming more difficult how some of those dollars are spent, how decisions are being made. There's very little local input and local control to how those decisions are made.
If you want to use Blue Cross as an example, I believe Blue Cross was the most prevalent insurance plan, private insurance plan in the local area before the Blue Cross CHI split occurred. And when that split occurred, it made it very difficult to take care of Blue Cross patients in the community. And obviously, if local decisions were being made, you wouldn't exclude your most prevalent provider. So I think, Molly and Brant can both give several examples of, well, for instance, Molly delivering babies. There's only one hospital in town, and if you have Blue Cross insurance and you have to deliver your baby at the hospital, where do you go? So I think that's an example of how decision-making is taking place elsewhere but affecting us.
We want to bring that even to the most basic level. It just came to my realization last week that our patients, when they call to order their meal, that order goes through Omaha, and then it comes back and the meal gets delivered. But our patients can no longer just call or be called by the cafeteria here at the hospital. The order has to go through Omaha.
So is it more so having to do with the service itself or the way that patients pay for the service?
I think it has to do with the payment of it, but the decisions about those services are not being made within this community.
If the services can't be provided, they can't be paid for, if they can't be paid for, they can't be provided to a large extent. So I think the services provided is good, it's just that there's a number of people that are excluded from those services because of the payment methodology.
As far as I guess maybe the time frame for all of this to take place, kind of give us an idea of what your plans are there.
We're looking at probably from now until we'll actually be able to see and take care of patients in a hospital, probably around 2 years, we're thinking. We're still in the planning stages at this point.
Would you see some sort of board of directors? Would it be physician run? What kind of organizational structure do you guys anticipate?
Well, the exciting thing about our plan that we have in place is that this would be a not-for-profit hospital, and it would be community-based, and so it's basically for the betterment of our community. And so, yes, there would be probably at some point, like all hospitals, a board of directors with some community members, physicians involved in that.
The governance will be locally
Local.
governed, though. It will have community businessmen, community clergy, physicians, people that know their way around healthcare for sure. But otherwise, there will be other community members on the board.
I mean, we have to look less than half an hour south down the road for a community that has a community hospital. I mean, is that, Marion Landing type setup? Is that similar to what we might envision here? Something that's kind of community run and.
I think so. I think that the community input is probably the most important thing to us at this stage. We want to give good care, and we want our community to be happy with that care. And we want them to have input. Another example is the new hospital in Kearney has been a success, and that has more of a community input. So we're kind of trying to model ourselves after those facilities.
What type of decision-making changes would you see under the new hospital versus what has been happening the last year?
I think decisions just as far as the day-to-day operations of the hospital would be made locally. Purchasing decisions, equipment decisions would all be made with the board members' input and physicians' input, the physicians that are actually using that equipment and have preferences as far as what type of equipment they would want or would desire. That would be just a couple examples of how we would want that to be more locally controlled.
Is there a sense that CHI maybe is using its resources elsewhere in Omaha or other communities and not in Grand Island maybe as they should be, that maybe we're a bit neglected?
I'd say there may be that sense.
Yeah, there's that. I think our guts tell us that we want to do something positive for this community. We see some things that have been not so positive with the current circumstance. That's not our play. We don't want to play that up. We want to play what we think is great about this. CHI is hopefully learning lessons along the way. We do not intend to run them out of business. We think that they do things that are very strong for our community. We will probably continue to use those strengths to take care of our patients and contribute to the good care of our patients. But there are other areas where we think we can do better, and we intend to.
And I'm sure you all have patients who would continue to go to St. Francis, and you would all like to continue to have privileges to be able to see those patients there, right?
Correct. Yeah,
I
we
think so,
anticipate
yeah.
being probably both places, yes.
So there's a big enough share for both?
I think
Share
so.
I think so.
Share of what?
Medical needs and that both could survive.
We sure believe so. I mean, Kearney's a smaller community, and they are supporting 2 hospitals, and in fact, their new hospital's expanding. So certainly think Grand Island as a larger community should be able to support 2, as they have.
Okay, so you're in the planning stages now. Where do you go from here? What are the next few decisions to make and the steps to take to make this happen?
So we're still working on the logistics, such as where to build and things like that, and exactly how big and number of rooms and things like that. So there are things that are still in the planning process, but we have a pretty good foundation of where we're headed.
Still trying to decide some of the governance structure, trying to ensure that that is locally mediated, that it, that we have local people involved, local decision making. So I think that's
Right now, in the depths of the legal paperwork that we need to put in place as a foundation.
Do you have kind of a working name for what we're calling this, or is that one of those things to still be decided?
Grand Island Community Hospital.
Where's the money for this project coming from?
There would definitely have to be some
If
fundraising.
you have a checkbook, get your checkbook out. You're part of the community. We're in.
So we'll plan to raise funds in the community and through investments, positions, and other investors.
The investment that's taken place so far has been only physician investment, and that is essentially to get the groundwork and paperwork put into place, the legal work put into place.
How much has that been?
About $150,000.
Do you have a number, kind of ballpark number of what it's going to take to get something like this off the ground?
We know in general it'd be about $1 million a bed to build, and so some of that's dependent on our fundraising efforts and how many beds we think we're going to need to provide the services that we'd like to.
Are there some kind of general services you envision as, like if you look at Kearney Regional, they're kind of doing things in phases. Would you anticipate that kind of a model, start out with, here are the basic services we're going to offer when we open, and then see where we go from there?
We'd kind of like to start out with a little broader service base.
Okay.
For instance, Kearney did not start out with obstetrics. And
right.
We would like to do that, and so we'd probably be closer to starting out with where Kearney will be after their addition.
What are some of the practices that would be covered then when you open obstetrics, and can you give some other medical?
So it'd be pretty much every specialty. So surgery, internal medicine, family medicine, pediatrics, urology,
Cardiology.
yeah, orthopedic surgery. I don't know if I'm forgetting one, sorry. Pretty much any,
Oncology.
that would be.
We expect to be able to service all of those patients, cancer patients. We know that one of the things that St. Francis is known for is its cancer care. We do not mean to supplant that, but we will help support those patients that are sick in the midst of their care. But St. Francis has a pretty good program, and we don't imagine that we'll step into that place, into that role.
Will this have outpatient also, because there's the outpatient treatment? How does that fit into this whole mix?
You mean the outpatient surgery center?
Yes.
The outpatient surgery center will probably stay as it is. I think this is planned primarily as an inpatient service facility, at least initially.
We're kind of in this brave new world of healthcare under the Affordable Care Act. I mean, does any of that play a factor here in terms of how you have to organize, Medicare, Medicaid, all these different factors? How does that play into all this?
Aside from being very scary, it scares us all. And so I think that we have to take that into consideration in the overall risks involved with this. You guys?
I mean, with affordable care, physicians could not own hospitals, but I think that works fine because our model is more of a not-for-profit, community-based, and so that's the direction that we're going.
So I think most times when I talk to doctors, they see themselves first and foremost as a medical practitioner, and then maybe secondarily as a business person. I don't know if you all feel that same way, but because a lot of you have your own practices, and this kind of puts a whole nother hat in the ring of also being hospital administrator or running it. Does that excite you? Does that frustrate you? How do you feel about being in this position?
I think if you have all 60 of us as physicians weigh in an opinion, you're going to get 60 different opinions. But I think in general, our core group is very much enthusiastic and energetic about this project. You guys can probably speak to your own perspective.
I think it's an exciting time. I think it's hopefully something where we can give back to the community and yet also help us take care of our community in ways that we feel is beneficial, both to the patients as well as to us as business owners. We also think though that we'll look for help in areas that we are weak in. There's definitely management companies out there. There's different people that can help us through all this.
We have a lot of talent here in Grand Island, and that's not just the physician pool, that's supportive talent, and we intend to take advantage of those talents.
What are areas that community hospitals can do better?
I think really focus on the healthcare needs of the community at a local level, and so supporting resources that may not be there, like maybe visiting nurses or specific projects that are able to be recognized in the community. And then again, local decision making goes a long way, just to be able to recognize what the needs are at a certain time and to be able to quickly act in that direction.
And I think it ensures that the resources that are generated in the community stay in the community.
And we probably should define community. Community is our neighbors and our friends, and not just our patients, but these are the people that we live with, we eat with, we go to church with. We want to take care of them, and we want them to have input into this.
I heard you talk about equipment too. Is there any equipment that Grand Island doctors would like to have that they haven't had access to, that maybe a community hospital would keep that resource and decision making and make it available, or make it the ability to have that equipment? Any equipment needs you can identify?
I mean, it's not so much that, it's more just kind of local decision making.
Okay.
So it's not what everyone across the whole country uses. We have to use the same. It would be more, if we feel like there's something that's better for our patients, we may be able to get that, or more economical or whatever. So
Everybody has preferences, especially in the OR, as far as what type of implant they like better, or what type of surgical device they like better. And it'd be nice to be able to, as a group of local physicians, sit down and say, okay, which company do we want to work with, which company do we like the best, versus saying this is the company you're going to use. But no, there hasn't been really any issues as far as not getting equipment that we need to take care of patients.
What type of response have you had from your patients?
it's been very positive, I would say. A lot, so many people in Grand Island have been affected, just different things with CHI, and so it's been very positive. I think people are excited about a hospital that's really community focused and community based, and so far it's been almost 100% positive that I've received as far as feedback.
Overwhelmingly positive.
Yeah, overwhelmingly so.
My office visits now take about another 5 to 10 minutes because my patients want to talk about this. They're as excited as we are.
And did I hear you say 60 doctors? So, I mean, obviously this is a lot of physicians from a lot of different practices in town who have been involved in this effort.
Correct. I think we have a sampling of just about all
Every group.
all the groups of physicians in town. And, yes.
So are you going to try to be in this medical strip area, or do you have?
A lot of you are in the neighborhood.
We're looking around at some different properties, so possibly in town, possibly, not exactly on the street, but we'll see what, we're not quite there yet.
Yeah, really no final decisions have been made on that at all yet.
Do you have a timeline on that location?
Not sure we have a specific timeline. It's going to have to be relatively soon.
Before the end of the year?
Well, I think
I
that
think
if we're
so.
going to break ground by this fall,
Okay.
possibly,
Mhm.
and consider our 2-year timeline starting now, then this fall we'll have to have a property and have a spade in the dirt.
How many acres do you need to have a hospital?
It varies between 20 and how big do you want, you know, we don't have the intention of having a Mayo Clinic here. But, you know, we can probably get by on 30 acres, 30 to 40 acres.
30 to 40.
Would you anticipate additional staff once you guys get up and rolling?
Oh, yeah, it'd take a lot
It'll
of
take a lot of
Yes.
people to run a
nurses
hospital.
and
Yes.
a lot of staffing to run a full-service hospital. Absolutely.
For you guys, once this is all done, you have the hospital and you have the patients. What is that one thing that you know that you have achieved your goal?
I think when this hospital is open and providing excellent care to the people in our community, I think we will have achieved everything that we wanted to.
I think when patients are telling their friends and family that you need to go to Grand Island Community Hospital, that's the place you want to go to get your care. I had a great experience, and the staffing was terrific, a great outcome. That's, I think, when I would see it as a success.
Have any of you had conversations with CHI administration about these plans? Or about any concerns even prior to this?
Been many, many conversations about concerns. I mean, I think as you look at our table, all of us have been really heavily involved in not only patient care, but also various groups, MedExec, leadership positions within CHI or within St. Francis, and have expressed concerns multiple times. So it's not a new thing.
I think 2 of the 4 of us were prior board members on the hospital board.
Okay.
And, but we've expressed our concerns and, you know, all along, and that's not just in the last year, but that goes back 5, 10, for me, 20 years.
Who was on the board, past members on?
I was on the hospital board, and I think
So was
Dr.
I.
Lerner was.
Okay.
And you guys?
I'm currently actually med staff vice president hospital.
So do you talk about it at those meetings also?
Oh, no.
Okay.
No.
We want community input, but maybe not at that level.
But I mean, obviously, like Brant said, I mean, we care about the care in our community, and so that's why we participate at, on the medical staff boards there, is because we want our patients to, and physicians to have good experiences and provide excellent care. And so obviously we care about it, and we've been involved there, and so, and we can, and continue to be. But, so we want to have a good relationship all the way around.
Do you think there's been a challenge for any particular, more of a challenge for any particular medical practice or specialty, or has it pretty much been frustration across the board, all specialties?
I think all specialties, but I think especially the surgical specialties, it's been difficult, just because your patient has to be in the hospital, whereas it's not necessarily always the case with other medical, internal medicine or family practice. OB, it's been huge, so.
I practice out at the Case New Holland Employers Healthcare Facility, where virtually every insured patient has Blue Cross insurance, and so it's been a real challenge in the last year where I practice.
I personally have Blue Cross Blue Shield insurance for myself, and when I think about this, I think how difficult is it that I can't receive care at my own hospital that I practice out of. But up until last week's
And that doesn't change
announcement.
the plans here.
No, because, I think the point we've tried to make is that this is not just about the Blue Cross CHI debacle. It is more of an attitude that we want to return to the community, that we have ownership and control of the quality of care.
As this Grand Island Community Hospital is in the process of being built, how do you guys maintain the level of care to the patients that they're currently receiving in the city?
I don't think that changes anything. I mean, I think that we're going to continue to provide the very highest level of care and service that we do now. And so it doesn't change how we provide care at all.
Do you think you will be blacklisted at all by the hospital or not be able to retain privileges of St. Francis by opening your own?
I don't think so. I think we have a great medical staff, and I hope that we can continue to work both places, so.
It
I don't
probably
think so.
wouldn't work
We'll see.
well for
No.
CHI either,
Yeah.
because there's 60
I think
of
St.
us,
Francis,
and
yeah.
the same 60 that have supported and built their current facility, if they were to cut us all off, you know, that would be kind of the death sentence for themselves.
Have you all seen a lot of patients in the last year throughout this debacle choosing other healthcare facilities because of the Blue Cross issue?
Oh, absolutely.
Yes.
I imagine OB especially.
Mhm.
Well, even in my specialty in general surgery, take care of a lot of patients that need to come in with acute illnesses, whether that be appendicitis, bowel perforations, acute cholecystitis, or gallbladder problems. And even though that there was supposed to be a workaround with that, where emergency services were to be cared for as in network, there was a lot of confusion amongst patients, and to the point where people were literally leaving the hospital to go somewhere else to get their care because of concern about cost. And you know, that's frustrating, not only for me, but also for the patients and their families. And so that was a huge problem.
Unsafe as well.
From a primary care standpoint, Brant takes care of them when they have appendicitis, but as a family doctor, I see them with abdominal pain. And so emergencies are covered under the plan, but non-emergencies are not. So when they come and see me for abdominal pain, I don't know if it's appendicitis. If it's appendicitis, it's an emergency, it'll be covered. If they've got the stomach flu and some cramps, it may not be covered. And so there's a great deal of patient angst about going to the hospital, even going to the emergency room, because if it's emergency, it'll be covered. If it's not emergency, it won't. So a lot of them have just simply made the decision to go outside the community for any of those kinds of problems and evaluations. They knew that it would be covered in a facility where they had coverage.
So have you seen a drop in patients? You,
Mhm.
local
Yes.
doctors?
I think all of our practices
Yeah.
have seen a drop, yeah.
Mhm.
What percentage would you
I think
characterize?
I don't know exact percentage, but I know like the amount of deliveries at St. Francis has been down this year compared to previous years.
I can tell you, 6 weeks into the split between CHI and Blue Cross, I had a 22% reduction in my inpatient care.
So have you been able to follow some of the patients to other facilities?
Well, they go elsewhere and they establish relationships, so, you know, they eventually they come back to me, but now they have a general surgeon or an orthopedist in Lincoln or Omaha, and they have trust in that person, and they'll probably go back to see those folks for their care in the future.
Could even this help us recruit more physicians to the community to have another option, do you think?
I think so.
I think
We've
so
had some
also.
excitement with people that are looking to come here, and I think it's exciting for physicians to see a physician, you know, kind of, or a hospital that's based around physician in the community, in the local community. So I think so.
It's a good question. We think
Yeah,
yes.
hopefully.
It's going to be great for that
Yeah.
purpose.